Hello, Don here. Welcome to Podiatry Practice Mastery, where we're helping you get your practice to the $1,000,000 mark and beyond. I'm going to talk a little bit about using virtual assistants and kind of doing it based on tasks versus hours. I just want to share my experience with this. What I tend to, or what my feeling is that when I hire a virtual assistant, they tend to want to use all the hours that I've given them. So recently we kind of upped the amount that we were going to spend with the VA, and it's amazing that they just kind of spend all this money for us. Now, I know it's bringing in revenue, but the challenge is when they send me their report, they have this little, it's called Clockify, I think it is, and they send like all the things that they do, all the things that you're working on, and it's a lot of different tasks, and they're spending a lot of time on it, and I found that it's almost like having an employee that's paid by the hour, and you let them kind of do anything that they want. And so what recently we did when we were meeting with this VA company is we said, okay, let's take this, and this was from the help of Sean. So Sean has a marketing company, and I kind of called him in. So I have this virtual assistant doing like a lot of the marketing, but he's kind of helping me how to manage them because I'm not really sure how to manage them. I don't think it'll be forever. He'll be with me, but he's kind of giving me some tips, and this last tip was great. So what we did is we looked at, okay, what main tasks do I want the virtual assistants to do? And so that there's no time bloat, I want to designate the amount of hours for them to do this. I know this sounds obvious, and I probably should have done this before, but it wasn't really obvious to me. And so what I did is I said, okay, well, I want one weekly email to go out to my whole list. So I think that should take maybe 2 hours. Now, I can probably do it quicker, but with them, I want to give them a little bit more time. They want to modify one page per month, so doing SEO for that page. And I said, okay, that should maybe take 5 hours. And then we have different ads that we go out. So I would say, okay, you can evaluate those ads. You can have a half hour a day to kind of work on ads per week. And then there is call tracking, and they're going to kind of follow up on those calls. And they're doing all this work saying they're like looking for these patients and calling them and stuff like that, but it's really not bringing in many patients, or these patients have already called automatically. So, giving them a certain amount of time. So I'm hoping that lightening this load will really simplify the work that they're doing for our practice, because we're trying to have it, but what I was finding is that as I was doing this, all their time was kind of using up. Okay. Next thing I want to talk about is how to recall patients. So I did this. I talked recently about Bonsai. This is this new product that's out there, but I want to kind of say what we're currently doing to recall patients. So currently within ModMed, there's something called Clara, and what this does is this automatically calls patients or texts patients if they miss an appointment. It only works, though, for like a couple of reach outs, and then it just kind of gives up. The nice thing about the Bonsai, my thought is that I can do Clara first, and then once that runs out, let's say after a week, it stops reaching out to them, then with this Bonsai, we'll automatically put this in this queue for them. Also, the other thing is when I'm recalling patients, one thing that I've taught my staff, and this is something I do it especially when I'm rescheduling or scheduling them to come back, is I'm starting to weed out high value and low value patients. And I'm not saying the patients have high or low value themselves. I'm just saying that in terms of revenue production and even concern of patients canceling. So if someone cancels one time, I'm going to put them in a 10-minute extra slot. Okay, that's fit in between my other 20-minute slots. So I have 20-minute slots all day long, and then I have these extra 10-minute slots that I'll put people if I'm concerned that they're going to cancel, or I put easy things in there. And I've mentioned this before, but for example, a matrix follow-up, or if it's going to be just a follow-up for like a foreign body that's removed, or some other follow-up of a cellulitis. These quick visits or wart, these types of things that are really quick, I'll put these in a 10-minute visit in between the other ones. And then I tend to save my 20-minute slots for higher value issues, so things that need more time. This is something that really helps me, so I can give them the time that they need, and these other ones, they don't take as much time, or if they cancel or if they don't show up, I tend to put those in the 10-minute slots. Another way that I recall patients is our weekly newsletter. Okay, this is something that tends to work well. I enjoy doing it, but it's a little bit manual intensive. But so all these things are helpful, but it's not driving a ton of these patients, and I needed this automated solution. So I even had my staff, they're kind of following up on content requests, but these are really manual manual labor heavy, and I think the turn is towards automation, and especially AI automation. So there is this new company that I've been learning about. It's called Bonsai. And what they do is they do all of these recall things, not all these things, but they basically recall all the patients in your practice for, and they have this like dashboard, and it's really, really reasonable. So something you might want to consider for your practice, and I think it's really going to go by storm here. They're just kind of starting out. They're kind of a startup seed tech company, but they've had a track record with a couple of another company anyway that's been very, very successful. And I think once this is set up in our practice, it's going to basically, you can turn it on, it'll automatically recall all the old patients at a certain interval. So something you might want to consider. Next thing I want to talk about is some of my failures in the practice. So I've been trying to use more scripts with plantar fasciitis, and what I'm struggling with is, and I've talked about this before. I tend to see the patient. I'll do the evaluation. I'll listen to them. I'll watch them walk, this and that. Then I'll kind of give them the diagnosis. Like, all of us know the diagnosis when they come in, right? We push on their heel, or they tell us, and we already know it. But we have to listen to them. They have to vent. They have to share their concerns. We say it's plantar fasciitis, and then before I jump into the treatment, okay, and this is kind of a mistake I've made in the past, I want to say, well, what would it be like if you didn't have this problem? Or what would it be like if this was resolved? Or what could you do if you didn't have this problem anymore? There's a couple words for this. It's called like future pacing, where you kind of say what it would be like with it. And so you kind of sell them the vacation, what it would be like with that already been resolved. And what I found is that when I do that, it's a lot easier to go over the treatments. And a real simple way of going over treatments, I find, is good, better, best. Now, there's a couple ways of doing this, but what I found works best for patients is I say, okay, I'm going to kind of go over all the different treatments, there's the good, there's a better, and there's like really the best thing. The good things are just like the stuff only that insurance covers, and a lot of times that's just cortisone and physical therapy. There's better things, but I'm going to go over the best. I'm going to go over what I think is best in your situation, what'll get you better for your condition. And this is usually after I'm doing an ultrasound. And then I can kind of go in and explain kind of the treatment process using my treatment sheet, where I can talk about the shockwave, the amnio, and then the orthotics to help it not come back. And so this is something that's really helped me versus overwhelming them with too many types of treatments. And what I used to do, I guess I do sometimes, is I piecemealed it into like, okay, we can do this first, then we can do this later. What I tend to do is I go the best route right away. Best tends to be the most expensive, but it might be the quickest way for them to get better. So I tend to go over the best first, and then if they're like, hey, I'm not able to invest in that, then I'll go kind of down. Okay, we can take certain things out. I never discount. This is something clear, and I've learned this both from my partner and from everything that I've read. I never discount. So if they don't want to pay that price, what I do is I take out certain items. So certain items of value you take out, but you never kind of discount them. I do give a bonus though, or not a discount, but I give them a prompt pay thing, because it's a lot easier for them to schedule all 6 shockwaves at once for my staff. And then I do give them a prepay. Kind of, I guess it is a discount, a prepaid discount. So this is something that we've been doing lately. So I think learning how to explain certain conditions to patients, especially when you're offering larger check items. And what I mean by that is it takes practice to say, okay, the amount for this is like $3,600 for this whole treatment process. And then patients, like, they get shocked. But that is the price. If you're doing 6 sessions of shockwave, if you're doing an amnio injection, and then if you're doing an orthotic, that is the price for that. And getting used to kind of explaining that. I don't tend to explain it on day 1. I might insinuate a little bit of kind of what's needed, but it's usually visit 2 when I do the ultrasound, and I'll go over that with the patients. And then if they say, oh yeah, do I have to do all of that? I say that's the best. There's better. It might just take a little bit longer. It might take longer for you, and you might not see the results, and you're going to lose the guarantee. So I always say this is something else. When I do the best one, I give them kind of a guarantee, and the guarantee that I kind of give them is, okay, well, if we're not seeing great benefit after the 6 sessions of the shockwave at the follow-up, I'll do a couple more shockwaves for no charge. So I'll do a couple more shockwaves. I'll do a couple more like lasers for them as well for nail fungus. If they do the whole the whole best option. If they don't, then I say, well, you're going to lose that little bit of a guarantee. Okay, so this is just kind of a wording method when working with patients. Once again, hope you guys found this beneficial. If you want to learn more or need help implementing this into your practice, reach out to me, Don at podiatrypracticemastery.com. Thanks.